bon après-midi. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view the city official who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today we'll be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Also on the call to answer your questions, we have Dr. Andrew Wilmore, Champlain Health Region Incident Commander, Chef des interventions d'urgence en santé de Champlain, as well as Dr. Doug Manuel, Senior Scientist of the Clinical Epidemiology Program at the Ottawa Hospital Research Institute, clinicien principal pour le programme d'épidémiologie clinique à l'Institut de recherche de l'hôpital d'Ottawa. Dr. Manuel can respond to questions about modeling. Il peut répondre à vos questions sur les modèles. After we hear from Dr. Etches, we will then take questions from the media. Please go ahead, Dr. Etches.
Thank you. I'm really proud of what the people of Ottawa have done so far to protect our community since the start of this pandemic. And so many people have been willing to protect others, to care for others. They've stepped up to help others. And this goodwill and hard work is going to be necessary as we continue to live with COVID-19. I know I can trust the Ottawa residents to continue doing what's needed to prevent this unmanageable increase in infections in our community into the future. Cette bonne volonté et ce travail acharné sont appréciés et seront nécessaires à mesure que nous continuerons à apprendre à vivre avec le COVID-19. So my update today is short, with a focus on some of the work that Ottawa Public Health is doing with different sectors, such as businesses, as we plan to move safely forward towards a way to live and work in a more sustainable way when the time is right. So Ottawa Public Health is working with the city's senior leadership team, members of the business community, various community partners, and many stakeholder groups to figure out what the best way is to gradually and safely move forward with COVID-19 in our community, following the direction of the province of Ontario and in coordination with the federal government. We must ensure that we continue to protect the people who are most vulnerable. And this is residents in long-term care homes, retirement homes, other group settings. So relaxation of restrictions will take time. We're not quite there yet. L'assouplissement des mesures de distanciation physique prendra du temps, et nous n'en sommes pas encore là. Protecting people has been the priority and will continue to be the priority. Most people are not immune to COVID-19, so when we begin to relax measures and increase our interactions with others, then there is a risk of increasing infection. COVID-19 will be part of our lives and how we live into the foreseeable future. So we need to find a balance of the risks and the benefits of easing restrictions, including identifying what we can do to mitigate those risks. COVID-19 fera partie de notre vie, notre mode de vie dans un avenir prévisible. Nous devons trouver un équilibre entre les risques et les avantages d'un assouplissement des restrictions, notamment en identifiant ce que nous pouvons faire pour atténuer les risques. Members of the business community want to help, and they want to ensure that the opening up of economic activity is done safely, so that businesses do not need to face closing a second time. Businesses are thinking about ways to operate differently to mitigate the risk of spreading COVID-19. For example, having more people work from home, changing the setup of some offices and businesses, and considering ways for employees and customers to wear masks and have easy access to washing their hands. These will all help decrease COVID-19 transmission. The desire to move ahead carefully is consistent with the direction of the province. The Premier has said that we need to move ahead in phases. We will implement a phased approach, and there will not be one date for everything to change and return to normal. So I appreciate this engagement with partners, stakeholders, and residents, and we'll work together as a community to inform how we learn to live with COVID-19 in the coming months. Nous travaillerons ensemble en tant que communauté pour informer sur la façon dont nous allons vivre avec le COVID-19. Enfin, un rappel lors des fêtes religieuses actuelles que des mesures de distanciation physique sont encore nécessaires et que l'ordre d'urgence provincial en vigueur exige que les personnes se rassemblent en groupe de moins de 6 personnes. So lastly, a reminder during the religious holidays that physical distancing measures are still needed, and the provincial emergency order in place requires people to gather in groups of less than 6. I encourage you to find new ways to celebrate with your family virtually and to limit your contact to members of your household as much as possible. Thank you, merci.
Thank you, Dr. Etches. In the interest of time, I will quickly read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. Your Community Voice, Patrick Guccione. TVA Gatineau, Ottawa, Louis-Charles Poulet. SusanSharing.ca, Susan Rogers TV, Gavin Lumsden. Radio-Canada, Laurie Trudel. Ottawa Sun, Taylor Blewett. Ottawa Citizen, Christina Spencer. Ottawa Citizen, Blair Crawford. Le Droit, Julien Paquette. Global News, Craig Lord. CTV News Ottawa, Josh Pringle. CBC Ottawa, Joanne Canello. 1310 News, Jason White. I will now invite each agency in reverse alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question et une question de suivi. A reminder for all the participants to please go on mute. We'll now start with Your Community Voice, Patrick Guccione.
Yeah, my question is for Dr. Etches. You talked yesterday and today again about how you want to have a conversation with public and business and that about how we move forward. And you mentioned about maybe more people working from home, but how would that work like in a restaurant setting? Like, do you think that would be the last one that would open? Fast food restaurants being different than a sit-down restaurant.
I don't have a definitive answer on that because it's going to be something that we work out with the province. But if you think about how they're operating now, they're emphasizing takeout. And you can imagine there are ways to operate that would provide less risk of transmission in terms of the number of people in an establishment, those kinds of measures. We are looking at what's happening around the world and trying to learn from others and monitor the impact of lessening restrictions on the infection rate and what happens. So I think we'll learn. We have some time. There will be interest in moving ahead with things that are less risky, I'm sure initially, and going slowly, and then moving to measures that are going to potentially provide more risk when we're more confident.
Thank you, Patrick. Do you have a follow-up?
My follow-up was for Dr. Wilmore. It's very specific to my coverage area, specifically in Canada. The Queensway Carleton Hospital put out a release, I think about a week ago, that they're going to be using one floor of a closed Canada hotel. They couldn't tell me when they might open that or might need that. Is that what you've been talking about trying to, open up some capacity in the hospitals for when we get to the peak? Is that one example?
So that would be an example of increasing hospital capacity as a physical space. There's different ways to increase capacity in terms of how you distribute patients, but also getting novel sites. That is a program that's under the Queensway Carleton Hospital, and I'm sure they'll be able to update us the details.
Thank you, Doctor. Thank you, Patrick. Maintenant, nous irons à TVA Gatineau, Ottawa. Louis-Charles Poulin, s'il vous plaît.
Oui, est-ce que vous m'entendez?
Oui.
Donc, vous avez mentionné que le virus serait présent à l'avenir. Est-ce que vous êtes capable de chiffrer à Ottawa jusqu'à quand on va devoir vivre avec ce virus-là? Puis comment on compte y adapter? Quelles sont les mesures qui sont prévues là, à court terme?
Je pense que j'ai compris juste un peu de votre question. Vous voulez savoir plus concernant le nombre des cas dans notre communauté et comment on va suivre cette situation? Est-ce que c'est correct?
Ben, vous avez mentionné que le virus serait dans la communauté pour encore un avenir
oui.
prochain.
Okay.
Êtes-vous capable de dire pour combien de temps et quelles sont à court terme les mesures qui seront prises?
OK, je comprends. Et peut-être Dr. Manuel veut aussi ajouter quelque chose concernant le modèle, parce qu'on utilise les modèles pour l'information concernant la duration de la virus dans notre communauté. C'est une question de vivre avec le virus parce que nous n'avons pas une population avec beaucoup d'immunité. Alors, c'est possible d'avoir des infections si on recommence avec les activités où nous sommes proches avec les autres. Il y a la possibilité de transmission de la virus. Jusqu'à nous avons une grande quantité de personnes qui sont immunitaires. Alors, c'est intéressant. Je pense, je n'ai pas toutes les exactement la solution je ne peux pas voir l'avenir, mais je peux imaginer que c'est important de faire la distanciation physique pour un long temps, le plus que possible. Alors, c'est une question de recommencer certaines activités, mais aussi garder aussi les activités qui donnent des protections aussi. Alors, ça, c'est comme j'ai dit, c'est un équilibre et on a besoin d'apprendre comment on va aussi. Est-ce que ça...
Oui, c'est bon, merci.
Bon? Okay. Doug, the question was also about why do we think we have to live with this virus for a while, and if there's anything else you wanted to add from a modeling perspective.
Well, thank you for, I apologize. Sorry, I'll put my video on. I apologize. I can follow a good part of it, but I'm going to reply in English for sure. You know, I'm not quite sure the best analogy. Sometimes I think of where we are is like a forest with a lot of dry kindling, and it's just ready. Like we had the warning, we had the lightning strike come down, and we had to really we were able to put out the fire, but we really had to control the whole forest. There's still so much kindling. Like I think we estimate at most a few percent of people are immune now in Ottawa. It's very hard to get estimates up more than 1 or 2%, which means 99% of people are still immune. If we took the restrictions off, we'd be back where we are in March with doubling times of 3 days, 3-4 days of cases. So we won't be able to slow, like we need quite high levels. We need about 60% of people immune before you could go back without having physical restrictions like we have, and the outbreak not accelerate. So we're still quite far away from that. There's still tremendous potential for this sort of explosive growth. And so I think the physical distancing that we're having is absolutely necessary. Once we get the numbers down, then we have more opportunities. Can we focus that down? But there's such potential growth for COVID spread still. Yeah, does that answer help?
Yes, thank you.
Merci Louis-Charles. Avez-vous un suivi?
Non, c'est bon, merci.
Parfait, merci. Up next, we have Sue Sharing. All right, we'll skip to the next one. We have Radio-Canada. Laurie Trudel, s'il vous plaît.
Oui, bonjour, Dr. Etches. Ma question concerne les centres de soins de longue durée. On a vu lors de votre mise à jour du nombre de cas confirmés que ça augmente vraiment beaucoup de jour en jour. Quelle est la stratégie de Santé publique Ottawa pour essayer de diminuer le plus possible la propagation dans ces centres-là où on le sait, c'est là où les gens sont les plus vulnérables? Et comment expliquez-vous que ça continue d'augmenter jour après jour?
Oui, c'est quelque chose qu'on fait ensemble avec les centres de soins de longue durée, avec notre partenaire dans le système de la santé. Et je vais inviter Dr. Wilmore aussi d'ajouter quelque chose. Mais c'est vraiment une priorité et il y a plus de soutien maintenant pour les centres. Les infections qu'on voit maintenant sont des infections qui étaient transmissibles auparavant. Alors, les mesures maintenant d'aider avec votre soutien, on va voir, j'espère, une diminution dans les cas après aussi la période d'incubation après 2 semaines. Mais Dr. Wilmore peut décrire un peu plus le soutien qui est là, la stratégie d'aider avec la situation.
Merci, Dr. Etches. Donc, nous sommes en train de collaborer avec les 4 unités de santé publique et avec le ministère des Soins et Langues pour déterminer les endroits où on a le plus besoin. Donc, c'est besoin d'EPI pour des personnels et aussi d'équipements. Donc, nous sommes en train de travailler avec ces organisations. Nous avons déjà envoyé équipe de réponse pour soutenir le travail de ces institutions et nous allons continuer à augmenter les recours qu'on peut offrir à les institutions. Vraiment, à titre de professionnel de la santé, nous sommes très préoccupés de la situation dans les foyers de soins de longue durée et nous tenons à protéger les personnes les plus vulnérables dans notre collectivité. Donc, nous allons continuer à travailler avec nos partenaires régionaux pour donner l'aide nécessaire avec la collaboration de Santé publique et le ministère de la Santé.
Merci, docteur. Laurie, avez-vous un suivi?
Oui, en fait, c'est toujours en lien avec les centres de soins de longue durée. Justin Trudeau, le premier ministre du Canada, a dit qu'il y a des gens de l'armée qui seraient disponibles pour venir prêter main forte en Ontario. Donc, j'aimerais savoir, est-ce qu'à Ottawa, on va faire appel justement à des soldats de l'armée pour venir aider dans certains centres de soins de longue durée où vous aurez constaté que la problématique est plus grande?
Donc, nous sommes en train de parler avec le gouvernement et j'aurai plus de détails à les prochains jours. Je n'ai pas l'information dans ce moment.
Est-ce que vous pourriez demander quand même l'aide de l'armée?
Comme je dis, je veux avoir les détails et je peux donner un update dans quelques jours.
D'accord, merci.
Merci, Laurie. Up next, we have Taylor Blewett with the Ottawa Sun.
Hi. So my first question is specifically about the cases that we're seeing in our community. I'm wondering, when it comes to people that have confirmed cases, are we noticing any pattern when it comes to, clusters in different neighborhoods or people in different living situations? I ask because the province brought up earlier this week that low-income families are turning out to be, very vulnerable to COVID-19. And I'm wondering if we're seeing that borne out in the data in Ottawa at all.
Thank you. Appreciate the interest. The kind of information we have about laboratory confirmed cases is they're add the address where the person lives. So we can look at that by postal code, usually, as well as someone's age and their gender. We have some information about Indigenous status. And then we are moving to replace our paper-based data collection system into something that is more automated for case and contact management, and that would be a system where we can add more variables. We can collect more information about ethnicity, for instance. So we use the geographic information as kind of a proxy sometimes for understanding income, because there are different average income levels by different geographies. We are going to share maps that are under development about the cases distribution across our city as soon as those are ready. What I can see in the rough drafts that I just got yesterday is that the COVID-19 infections that are laboratory confirmed are across our whole city. They're across all of our geography, urban, rural, suburban. So there's really no community neighborhood that stands out as unaffected, or so that is something we're interested in. We'll be able to provide more information about. We are aware that often the kinds of things that are associated with lower income can put people at higher risk for infection. And so we would not be surprised to see that. There's different pressures. People with lower incomes often have work that doesn't allow them to work from home as easily. There's different kinds of things that could put people at higher risk. That's why we need everyone to do their part so that those who do need to go out to work are protected.
Thanks so much. And my other question, like we've been seeing, or we will be seeing from the provinces who are promising kind of formal frameworks for reopening the economy and easing some restrictions, is that something we will see at the city level here in Ottawa, as made public, some kind of plan or outline for how we're going to go about this process? And if so, when might we expect to see that?
So the first thing that we're hoping to launch as a city with public health would be information that forms a foundation for discussion. So that would give the population, people in Ottawa, a sense of the kinds of questions that we need to address, the kinds of safety measures and criteria that need to be in place, and people can comment on what they're seeing. So we'll begin with not a, here's the plan, we've made all the decisions, but a framework for building understanding of the risks and the ways to mitigate risk and the trade-offs that we need to make potentially as a community. All of this will be in the context of the provincial framework. So if we get more information on that before we launch our public engagement platform, we would build that in. But we are hoping to launch that within the next week.
Thank you, Doctor. Thank you, Taylor. On to Ottawa citizen Blair Crawford, please.
Hi, I'm just the province had announced the SWAT teams that were going into long-term care homes and retirement residences. I'm just wondering if there are homes in Ottawa where they've been deployed, which homes they are, and what the nature of the help is they're providing.
So we are working in collaboration with the 4 local health units and the Ministry of Long-Term Care to determine the long-term care facilities in the most need of urgent staffing, of infection prevention and control support, as well as availability of testing. And we're currently reaching out to all these organizations. So we have sent our response teams, which are analogous to the SWAT teams that the Premier mentioned, to 4 of these homes already, and we're rapidly ramping up those activities. So more and more are going to be coming in the coming days. Staffing support is ongoing, and the facilities that have provided the staff include the Ottawa Hospital, Queensway Carleton, CHEO, Montfort, and the Champlain Home and Community Care, and these are being deployed through several homes in Champlain. This is something we're taking extremely seriously. As healthcare providers, we're very concerned about what's happening in long-term care homes, and we want to ensure that we protect some of the most vulnerable people in our community. So this is going to be something that's evolving, and we will provide updates as we expand our program to cover the entire region.
Thank you, Doctor. Blair, do you have a follow-up?
I guess follow up, although it's not really related, but earlier when I think it was Dr. Manuel was talking about the 60% threshold needed for herd immunity, if that's the term. Is there any way to get there other than just waiting for the disease to spread gradually through the community? Is that what you're looking at?
Is that a question for me?
Yeah, I was going to say, who wants to take that one? The balance is not, it's the same as why we're in this situation right now. It's that if we have the increase happening too quickly, we can overwhelm our healthcare system. We've seen that in other countries. That affects everybody, whether you have COVID or you don't have COVID. When you need your hospital, you need your hospital to be functioning. And it affects older adults, unfortunately, the most in terms of death of people over 70, of people over 80, and so that's what we want to avoid. If we just say, let's build up the immunity too quickly, that means lots of infections all at once. That's the kind of thing that would happen. And Doug, you probably have a more scientific.
The definitive answer to if you want immunity is either you acquire it from being infected or you have a vaccine, and that's why there's so much interest in vaccines as well. But of course, that's going to take a long time to develop. So between now and a vaccine is our where we need to figure out a plan. And is the plan to try to build up immunity by protecting our most vulnerable? So, if we can reach the 60%, but not have that 5 or 10%, that's an option. But, I think as a modeler, we try to feed this information to Vera and the folks that can look at the entire picture and say what are the best options. But I think the two options, broadly, the options are: can we build up immunity, or can we completely suppress, keep very, very low levels, and try to localize those levels so they don't spread. So we keep at a low level of immunity, and not go for herd immunity. Wait till the vaccine. I think those are the two approaches. And which one we're going to go for or decide to do both. I think that we still need some information. I think at this point we're still not able to put those on the table, so we're still having to really get our cases down to create these options to then say, should we try to have a slow level and build up immunity while protecting those people and have capacity, or should we try to see if we can't control COVID altogether? And countries like New Zealand are thinking that way.
Thank you, doctors. Thank you, Blair. Maintenant, nous irons à Julienne Paquette avec le droit. Julien?
Oui, bonjour. Je ne sais pas à qui s'adresserait cette question-là, mais on voit dans les chiffres qui ont été dévoilés hier en fin d'après-midi que presque le tiers des décès qu'on a eu à Ottawa jusqu'à maintenant proviennent du même centre de soins de longue durée. Donc, est-ce qu'il y a quelque chose qui peut expliquer cette statistique-là? Dans la façon, par exemple, que ce centre-là a géré la situation, ou c'est un cas de malchance?
Peut-être Dr. Wilmer veut ajouter quelque chose parce que je ne suis pas un expert concernant les opérations des centres de soins de longue durée, mais je sais que les employés, les directeurs dans les centres de soins de longue durée sont vraiment, ils travaillent fort. C'est difficile de voir une situation où les résidents sont en danger. Alors, c'est une question de la population. La population est plus vulnérable, la population est plus âgée, souvent avec et je m'excuse en français, je pense les populations à beaucoup de personnes qui vivent avec dementia aussi. Alors, avec cette maladie, c'est difficile de contrôler le mouvement des gens dans une institution. Alors, c'est plus difficile de isoler et arrêter la transmission. Alors, il y a beaucoup de facteurs qui affectent le résultat dans une maison. Et maintenant, on voit dans beaucoup de maisons, c'est difficile que les employés sont malades. Il n'y a pas le nombre des employés comme habituel. Aussi, les familles font beaucoup dans les maisons de soins de longue durée. Et maintenant, les familles ne sont pas disponibles de visiter parce qu'ils veulent protéger la population avec la réduction dans les visiteurs. Alors, c'est vraiment différents facteurs. Dr. Wilmore, je ne sais pas si vous voulez ajouter quelque chose.
Oui, donc nous voulons dans le secteur de santé soutenir l'aide pour ces institutions. Donc les hôpitaux de la région s'unissent pour prêter main forte au personnel des foyers afin d'offrir des résidences sécuritaires de grande qualité durant la pandémie. Donc nous sommes en train d'aider pour le point de vue de le système d'EPI dans les institutions. Aussi avec du personnel et aussi avec de l'aide clinique pour faire des tests et pour donner des soins pour ces patients. Donc, c'est tout connecté. Comme Dr. Etches a dit, c'est une population vulnérable. Et aussi, ils habitent dans un environnement avec beaucoup de contacts. Donc, c'est très important de travailler avec santé publique pour faire les mesures nécessaires pour prévenir cette situation.
Merci, docteur. Julien, avez-vous un suivi?
Oui, ben en fait, il y a peut-être un élément de ma question qui a été mal compris. C'était plus spécifiquement au centre de soins de longue durée Montfort. On rapporte jusqu'à maintenant 11 décès. Et quand on en a 35 dans l'ensemble de la ville, donc c'est près du tiers des décès à travers la ville qui proviennent de cet endroit-là spécifiquement. Est-ce qu'il y a une raison en particulier pourquoi ça s'est produit à cet endroit-là ou c'est tout simplement de la malchance, dans le fond?
Comme Dr. Etches a dit, je pense que c'est une réponse compliquée. C'est au niveau de la population qui est affectée par le COVID-19. Nous sommes en train d'aider le site Montfort pour la réponse. Donc, comme nous voyons qu'il y a un outbreak, quand on a un outbreak dans une institution, c'est très important de réactionner d'une manière coordonnée. Donc, mais pour votre réponse pour votre question, je pense que c'est pas on ne peut pas simplement dire oh, c'est une chose. C'est beaucoup de facteurs. Mais Santé publique fait des investigations avec tous ces cas.
Merci.
Merci, docteur. Merci, Julien. Up next, we have Craig Lord with Global News.
Hi, this would be a question for Dr. Etches. It's a follow-up to something I believe you said yesterday during the council meeting. You mentioned that one of the early ideas when we do get to the point of relaxing restrictions might be expanding the household bubble. The example of maybe two older adults that have been isolating could see each other, or setting some kids up for play dates in a controlled situation. Do you have any other details about what that idea might look like in practice, or any conditions that might be placed on that if an idea like that were implemented?
I did put out the idea of trying to make the strict limits on social connections with people outside of our household as reasonable as possible while maintaining as much as possible physical distancing. And so the idea being that maybe it makes a big difference if someone who's completely isolated can then have one friend over or vice versa. That's a huge increase in social connection for a relatively small increase in risk of transmission of infection. So these are the kinds of things that we're interested in looking at. I, again, probably am not the final decision maker. I want to collect these ideas. These ideas come from residents in our community who are describing how hard it is right now, and they're offering suggestions. I want to feed those suggestions back up to the province. And if there's a way to adapt some of these things locally at the local level, then certainly, I think we want to take a reasonable approach, knowing that we have to live with this virus for a longer time.
Are there any particular channels that people can reach out to you or to the province when they do have ideas like this that you would recommend they go through to get their ideas for social connection out there?
Yes. So, as I say, we want to launch something more formal so that we can collect this information in a systematic way. But in the meantime, people have some burning ideas. They can always email our Ottawa Health folks, a team. I believe it's Ottawa Health at ottawa.ca and Health Santé ottawa.ca. And those all get read, and those will all be summarized. We'll keep track of those ideas and feed them in.
Okay, thank you very much.
Thank you. Up next, we have Josh Pringle with CTV News Ottawa.
Thank you very much. This is a question for Dr. Etches. We were speaking with an individual who tested positive for COVID-19 and lives with 3 brothers. He's been told that all 4 have to quarantine until May 5th, which would be about a month after he initially tested positive. We were just wondering if you can clarify how quarantine works for a household with multiple family members. Is it once the first person is recovered, or do they all have to stay in quarantine for a set period of time?
Yes, so I don't know about the specific situation that you're describing. Typically, we know the virus takes 2 weeks, a maximum incubation period to show up if you've been infected. And so that when someone's in contact with a family member in the household, we do ask them to try to then keep that distance from somebody who's infected, and we count the 14 days from their last point of contact with that person while they were infectious. So there's a few things we have to say. When was that person who tested positive infectious? And we count that from the time somebody first developed signs of illness, a fever or a cough. We count out 14 days from that to be safe. After that period of time, we're pretty sure they're not infectious anymore. Or if they still have symptoms, we have to go even further to 24 hours past that resolution of the symptoms. So there are different ways that gets calculated. If there are specific questions, this is what our nurses do, is case manage and help with the context of cases. So they work through all these different scenarios, and they coach people on how to do this within a household, because it's challenging. Obviously, some people do not have any space for somebody who's infected to isolate in a different room, to use a different bathroom, to have food delivered to the door of that room. Those kinds of things can help decrease transmission in the home, but it can be challenging, and our nurses will walk people through that.
Perfect. Thank you. No follow-up.
Thank you, Josh. Thank you, Doctor. Up next, Joanne Canella with CBC Ottawa.
Oh, hi, thanks very much. I wanted just to follow up a little bit on long-term care homes. I don't know, Dr. Wilmore, if you can identify the 4 homes that the hospital, the health sector here has sent people to, as well as just expand a little bit more broadly on how you're dealing with that issue. It seems like there's 2 different crises here, a community one and a long-term care home. If you have enough people to do all the testing. So if you could just expand a little bit more on how the health sector here in Ottawa is responding to the long-term care crisis?
Absolutely. I don't have the list of the facilities off the top of my head. I apologize, but I can get that information to you. So we're working in collaboration with the 4 public health units, the Ministry of Long-Term Care, to determine those long-term care facilities that are in most need of support. And we are in the process of ramping this up very quickly. So we've already sent a response team to those 4 homes to give them support in any aspect of their response to ensure that the infection is contained, and also that we have all the necessary equipment and staffing necessary to provide care for these patients. There is a clinical arm to the strike team, or to the response team, sorry, that we are deploying. And that clinical arm allows us to, and that's local family physicians as well as community paramedics, and that allows us to actually expand the testing capability within those institutions themselves. So we get our marching orders in terms of how we go about the swabbing from public health, and we are the clinical arm to support them. And it's oh, sorry, I have the homes here. So we've gone to Carlingview Manor, Montfort Long-Term Care, the Madonna Care Community, and Laurier Manor. But again, this is a number that is currently in the rollout of this process, and we're looking to expand that to include the rest of the region. From the point of view of staffing, staff from hospitals in our region have really come out to have answered a call for volunteers. I want to reiterate that here. So although we have folks that have started volunteering for shifts in long-term care, we're asking for any and all staff who's interested in performing some shifts in long-term care to speak to their managers within their institutions. This is work that's fully compensated, and you'd have the full support of your organization, and you'd be provided with all the necessary personal protective equipment to keep safe. This is a very vulnerable population. It's really a top priority right now. Our situation in the community, due to the public health measures that folks have been compliant with, has been very effective. And now we need to make sure that we don't let anyone slip through the cracks. And we're working very hard with our partners to make sure that we can provide this care and this support that is clearly needed.
Thank you. That's a great answer. I don't know if anybody else was going to weigh in. Sorry, I didn't mean to jump in. No? Okay, I do have a follow-up then actually for Dr. Manuel, and I apologize if this is too complicated on the call. We can take it offline, but I was reading the recent modeling that came out earlier this week, and it spoke about 63% physical distancing effectiveness, that if 63% of people keep their physical distance, it reduces hospitalizations by 99%, which is amazing. But in an earlier poll, we talked about people being physical distancing, that there were 85% of people said they were physical distancing. And it's caused a little confusion in our newsroom. I'm not sure if I am mixing up 2 different theories or systems. So I was just wondering if someone could address that, please.
Yeah, I'll take that one for sure. And no, I appreciate the question. And if you have suggestions about how to communicate this clearly, we can talk offline as well. And we're definitely open to feedback about how to present this. These were the same sort of numbers that we saw presented in British Columbia about those sloping curves and different scenarios. There's the term we've tried to use is physical distancing effectiveness, or this how we're observing it actually play out, and so not how people report, but how it's actually playing out, and it's a mathematical calculation, and you can think of it like if I have COVID and you don't, there's a probability that I'm going to transmit it to you. And that probability is basic. I mean, that's the R naught that you hear about, and that's a product of the virus, like how the characteristic of the actual virus. And then, but we can reduce that probability by distancing ourselves by control measures, and so we can calculate where we actually are. And again, the technical term is RT or doubling time. So at the beginning of the outbreak in Ottawa, we saw a doubling time of like 3 days, and now we're seeing a decrease. I think it's of I forget our decrease now, or we call it halving time of 33 days. So we can calculate how much less transmission there is between people, and it's a number between 1 and 100. And so that number right now is 63. And that's why we're seeing a decrease in cases in the hospital. This is all based on hospital data. That's why we're starting to see a decrease in the hospital. So we're above that kind of magic sort of number around the 60s, and we're starting to see a reduction because we have this effective physical distancing that is calculated. So maybe I'll stop there and see if how that explanation works for you.
And maybe I could just jump in terms of explaining that the 85 or 84% number came from polling. So that was people reaching out to a random sample of folks online to ask them about their behavior change. And so it was 84% of people said they had changed their social behavior. And I guess the difference is self-report and actual effectiveness being measured in terms of what shows up in hospital. So,
yeah. The only other part of that.
So the latest number is more accurate than the poll, then.
Well, and the other part of the equation is a lag in time. So if we like, I think we actually are going to have an effective social distancing up quite a bit higher once we have that time. So last week we were doubling we calculated 33 days halving time, and the week before we increased a 33-day doubling time. So it's coming down, like our effect, or the week before it was 50% physical distancing effectiveness, and now it's 63. We haven't changed our policies, but we're seeing those numbers climb up, and that's because now it's taking a while, that lag time, 2 or 3 weeks to sort of settle in. I'm not quite sure what the numbers are going to be next week. They're a little bit difficult to project, so that's why we're just kind of doing all the projections of what we see last week. But if we have a few more weeks, we're going to now be able to get a clear trend and see where we might start leveling. I'm hopeful it's going to be leveling, well into the 70s, maybe even higher, 80s. But we were too early to say that. But this lag period that we're going to creep up to where I think that we're seeing the self-reports. But so that's what we're observing today. Like, we're seeing that transmission being broken down to about 63% today.
Thanks very much. I'll probably take that online for a few more details, but I appreciate that.
Thanks to both. Up next is Jason White with 1310 News.
Hi there. I'm not sure who the best person to handle this would be, but my question is about the deaths we've seen over the last couple of days in long-term care facilities. I'm wondering to see, I believe it was 6 deaths at the Montfort Long-Term Care Center yesterday, and then 3 deaths at the Madonna Care Community in today's report. I was wondering if someone could shed some more clarity on why we see multiple deaths reported on the same day at the same facility. I'm wondering if it's the timeline of the virus, if people get sick around the same time, therefore they die around the same time, or is there some sort of delay in reporting from the facilities and that information coming through the chain to OPH, so it arrives at OPH a bunch on one day? I wonder if there's any clarity that anyone can offer around that.
It's probably all of the above. There's lots of different factors in terms of why we get a report of a death when we get it. So sometimes the test has been taken and then we don't get the confirmation of the laboratory test being positive until after somebody has died. And so then we get the laboratory tests at the same time, but even though somebody died at a different time, sometimes there may be, unfortunately, there could be deaths at the same time that they may have been infected around the same time at the same incubation period. But every person's different, how they handle the virus, how sick they get, how quickly they get sick. So I don't think we can read too much into exact time of reporting of death. Overall, of course, we don't want to see the deaths increase, and what's important is to make sure that the homes have the support they need to stop transmission of infection through infection prevention and control practices. The right equipment they need, gloves, gowns, masks, the right practices, and having the support of enough people to make sure that they can carry out their work in a way that is safe for everyone. So, yeah, so sometimes when we get the report, we usually get the date of death, and it's not always the same day that it shows up in our table, I guess is a simple answer.
Okay, thank you. For my follow-up question, this is also an Ottawa Public Health question. Is there any sort of timeline or scenarios that are laid out at OPH right now in terms of when we could handle things starting to reopen, whether and have everything we need in place, whether it's getting to that 60% immunity or having enough testing and contact tracing all in place? And the reason why I asked this is because we heard yesterday the city, from a financial perspective, has a couple scenarios when they think things might begin to get sort of back to normal. So are there any timelines or scenarios that at Ottawa Public Health? And if you don't have specific timelines that you're sort of working from or sketching out, can you sort of expand a little bit more on why not?
Okay, lots of parts to that question. The thing that we're focused on at Ottawa Public Health is making sure that the safety features that we need to have in place are in place before we do any relaxing of restrictions. And so this is a collaboration. It means we're talking to Doug actually about how's the hospital doing? What's the data in the hospitals about their bed capacity? Have we built up enough room to handle an increase in infections again in terms of our numbers of ventilators? And so we need to know that our hospital system can handle an increase in infections again. We want to see our vulnerable population protected, and we know that outbreaks that we're seeing right now in long-term care and retirement homes should be under control before we think about possibly increasing the risk of transmission again. And so, these things we're watching. In terms of the other pieces, some of these things we need in place are provincial. We need a surveillance system that tells us about the level of infection in our community or the level of immunity. There's different ways of looking at it. And so that's a work in progress. When it comes to our own team's ability to do case and contact tracing, we have done projections and thinking ahead of what we might need. The team is sufficient right now for the number of positive tests that we're getting. We can do that follow-up in a timely way. But if we're able to ramp up our testing, which is another factor that we'd like to have in place, then we need to continue to grow our team to be able to follow up with all of the positive cases found. And so that is part of mapping out. We don't know all of the variables in terms of when we'll have more testing or all of these things in place. And yet it's not too early to plan, right? So what the city is talking about is it makes sense to be ready for when we can go, and it's not too early to get input from the public and think about that. So in terms of our work right now, that's work I'd like to see happen in the next week. And then the overall timelines are going to be set with the province. So the province really is the bigger policy setter here in terms of timelines.
Okay, thank you.
Thank you, Jason. Thank you, Doctor. Just before we leave today, I just want to add one quick correction. The email address that Dr. Etches had mentioned for residents to send their ideas and thoughts over is healthsante@ottawa.ca. So healthsante@ottawa.ca. That's HEALTHSANTE@ottawa.ca. Puis en français, l'adresse courriel que Dr. Etches avait mentionnée à propos que les résidents peuvent envoyer les idées à propos de l'économie et comment rouvrir la ville, c'est healthsante@ottawa.ca, HEALTHSANTE@ottawa.ca. And that's all the time we have for today. So thank you all for joining us. Merci.
Merci.